Thank you. Great to be here. I'm Jeff Levy. I'm a practicing house call veterinarian in New York City, New York metro area, and I'm also internationally certified in animal acupuncture. So what I'm going to do is share some of concepts of how I built a practice and also what a practice day is like for an animal acupuncturist. How do you know it works? They can't talk. Sort of became the motto for my professional development. Here's my 4 compass points in my life. Born in Brooklyn, started playing with earthworms in the backyard and bugs and cicadas. You know, those bugs that make a lot of noise. Spent a few years in Italy, learned enough Italian to pass the entrance exam. In those days, you couldn't even get into vet school from New York City. Learned Italian, became an interpreter, and went to a few years of education in Milan, Italy, Perugia, then Milan. Got a transfer position in my beloved state of Mississippi, and ended up getting a job teaching Italian to the football players as a part-time job to help support myself. And then eventually became a house call veterinarian in Manhattan and beyond. In the middle is me hanging out with my partner in crime. He's from the New York City shelter. His name is Asti Spumanti. Now there's a reason why it was Asti Spumanti. I sort of combined Italy. I couldn't call him Grappa. What happened is he was in the kill shelter and he was stuffed into a cage. He was about 18 pounds when I got him and he couldn't move. So I adopted him and he was champagne colored, but I did not want to call him Champ. So I said, what could be something in Italian? It's frizzante. So he became Asti Spumanti. And more about him later. So here's my first gig, a cozy little venue called Madison Square Garden. I was out of the country. I was living and working in Mississippi at vet school, interning, externing, you name it. And I was sort of cut off from American culture. So my first gigs, I'm the official veterinary acupuncturist at the International Cat Show in Madison Square Garden. Now, have you ever been to a cat show? No. It's a really low-key event. There's so many stories I could tell you about the cat show. It would be another day. But this is really my first gig, and people are sort of, it's not like the Westminster Kennel Club where everybody's dressed in suit and tie, and they're cat people. It's a little bit different. So here I am, like sort of first day on the job. I have my booth. There's a cat acupuncturist, there's a cat chiropractic, there's a cat homeopathist, you name it. And down the aisle, remember I'm right off the boat, just back to New York City, there's a camera crew. Lights, bunch of people. And this lights and the camera crew is getting closer and closer and closer, and I see people fleeing right and left, getting out of the way of this camera. And I stood there like the proverbial deer in the headlights. Stood there, and some guy comes up to me with a microphone. And he goes, acupuncture, acupuncture. How do you know it works? They can't talk, pointing to the cats. So I thought a second, and I said, well, sir, how does the pediatrician know the kids are getting better? They can't talk. And with that, he left with the whole camera crew. Just tell the truth. That's the first motto, I think, in building a good practice. I think you mentioned that, tell them the truth. You can't help them, let them know from the get-go. So here I am off on my rounds. I'm going to take you on a virtual day, idealized day, where I'm going to go to people's houses, you're going to see what I do, and you're going to meet some of my favorite patients. But here I am on the Upper West Side, 86th Street, and it's a really busy day. I may see 7 to 9 people. And actually, I'm returning my callbacks as I'm getting in and out of the subway, but the best way to do it is the subway, at least in Manhattan. And here I am. I probably wanted to be a mailman in my younger days because neither rain nor sleet nor gloom of night will stop me from reaching my appointed rounds. And I got to be honest, I've walked through hurricanes, trudged through blizzards, and not always on time, but I get there. There I'm going up to an apartment. I meet my pals along the way, the dog walkers. I know a lot of people in the neighborhoods. So here's patient number 1. This is Lucy Waterman. Lucy was diagnosed with a severe Achilles heel injury, and it was seen by the orthopedist at the Animal Medical Center Referral Institute, seen by the neurologist. And who do they send it to? The acupuncturist. When you can't resolve it with any other method, To their credit, they did all they could medically do to help this dog, but it had a dropped Achilles heel, and we did fairly well doing acupuncture. You can see all the needles. Human acupuncturists recognize the very same points we use. We call it governing vessel 20, an anshen, bladder 23, which is association point or back shoe point for the kidney, associated with bone in orthopedics, and bladder 60 for the Achilles heel. Now, sometimes in my rounds, I run across dogs that are handicapped. And here's Bo. I remember my first day in Mississippi State University, I walked out in the clinics with my chart for my very first patient. And I walked out into the waiting room, and I called the name Bo. And about 6 dogs got up at once. There was B-O, B-E-A-U, B-O-H. Bo is a very common name, but this was a Bo who lived in New York. Bo was found by this woman in the blizzard in upstate New York. The amount of compassion and dedication that I see in my daily rounds just makes it it makes me so happy to be there and be part of their lives. Bo was diagnosed with either a fibrocartilaginous embolism, that is a sort of stroke in quotes to the spinal cord, or a very subtle intervertebral disc problem. Again, this was seen by specialists, but couldn't be exactly pinpointed. So they turned once again to the acupuncturist, and you can see I'm helping Bo there. And he did very well. We've done videos of Bo. You can find them on my YouTube page. Now, sometimes it's the people who have mobility problems, so that's another beautiful thing you can do with the house calls. You can see people who can't get around too well. And I know general acupuncturists in the human world treat atopy, or itchiness, or skin disease, allergies. And this is a Westie, a white-coated dog, and it's very common in pit bulls as well. Itchy skin, that's considered, we treat lung points that disperse and descend yin elements to the skin. So here we are treating a Westie for itchiness, bad skin. Oh, cats. Yes, you can acupuncture a cat. In fact, you can acupuncture 2 cats at the same time, if you keep your eyes on them. This is Rourke. This is Rourke, about 20 pounds, grouchy. And this is Pandora, about 18, who's a screaming Mimi. But as you can see, you could have put the right acupuncture points, governing vessel 20 on the head. I put an extra one in just to make sure. So again, remember that question? How do you know it works? They can't talk. Augie, the owner, had called me because he was convinced that his dog was suffering from degenerative myelopathy, which is a destruction of the cauda equina, the most distal regions of the spinal cord, and leads to gradual paralysis. Now, everything this owner told me over the phone just didn't sound like DM to me, but he was so concerned about this degenerative myelopathy, I encouraged him to finish his diagnostics. Again, he went to the Animal Medical Center, saw the orthopedist, saw the neurologist. When they told him, I said, when you're done researching this issue, then I'll come over and we'll do the acupuncture. And he did just that. And we did acupuncture for quite a while on Augie and benefited from it. Again, I acupuncture cats. When we talk about cats, we talk about, they're a little bit more skeptical than the dogs. The golden retriever, you'll put 25 needles and it goes to sleep, snores, or for the cookie, it's a deal. Kitty's a little bit more skeptical. You can't hold them. You got to manage a cat. It's got to be their idea that they were in place, correct? So, or better yet, if they're sleepy, you're in good shape. So yeah, as a house call vet, I'm at times called in for euthanasia at home. People appreciate the privacy. Most often it's at night. I book a lot of free time. I make it a last call. I've been at doggy wakes, cat funerals. And it's true, people will have wake parties with the pet there. And we do it very slowly and very gently. So as you can see here, this cat was not being euthanized. It just had a very bad haircut. And it was just sleeping in the sun. But it looked pretty dead to me, so I thought it was a great picture to. Part of being, I think, a good veterinary acupuncturist, being a good vet or being a good practitioner, it's to network. And to network with the right people, learn from good people. These are a couple of people I'm proud to say I'm friends with. Dr. Peterson, Mark Peterson, I studied him in vet school. He discovered the existence of thyroidism in cats, discovered the disease. I can't tell you how many lives, feline lives he's saved by discovering this disease and proving its existence. Why? We can treat it with a little thyroid supplement, just like with people, okay? It's actually hyperthyroid, so we use a different type of medicine. But I studied him in college, and I'm so happy to be able to attend the conferences of having him sit next to me. I'm very proud of that. And Dr. Goldstein, you've heard of the Animal Medical Center in Manhattan? He is probably the world's expert on Lyme disease on dogs, and he's published all over the world. And not only being an expert, he's a good guy, and he cares. So, you know, hang out with the right people like you do, and it'll help you practice. Plus, the best referrals in the world come from fellow practitioners, don't you think? You know, people, and I know I spoke to so many people at our table here that many of them won't take on a patient without a proper medical referral or having some sort of medical backup. It's really important to know what you're doing and don't make false promises. Occasionally I have TV appearances. This is Joan Rivers, late great Joan Rivers, who was a darling. And I got a call to come over to her mansion, her palatial mansion on Fifth Avenue with Melissa, her daughter. She was contemplating putting her dog to sleep. So I'm standing there with Joan. Joan is crying, and her daughter is on the couch, and we were talking about end of life for Max. And I get done with the discussion with Joan Rivers, and I look down, and I have Max standing at my feet between us, and I said, Joan, I think we have a third opinion here on what we're going to do today. So I think Max went on to live another 3 months after that, but that was a great experience. I'm also very fond of birds, and I grew up with a parakeet. But don't do what I did, okay? I'll tell you, I'm a vet, I was supposed to know this. I found a bird all the way downtown in the Village. I found a box, a shoe box someplace in the garbage. I cabbed it up. I had another 6 calls that day. Went to it's the Wild Bird Center at Upper West Side. And the director says, Dr. Jeff. She says, you know better. I said, what? She says, you should know better. She says, now take this bird back all the way downtown and put it back in the tree. Because the best thing is mommy, either find the nest if you can do that, or at least it's got a better chance, statistically, of surviving outside in the vicinity. The parents might want to feed it. So learn by doing or doing wrong. Even we vets make mistakes. So I went all the way back there. And if you see my partner in crime down there, that's Asti, just hanging out, the cat with a large girth there. If you can involve yourself in community activities, I found that's really great. It's great on Facebook. I don't know what I would suggest in the human world, but I know we animal people are crazy. I go frantic when I see a lost cat or a dog poster. So I immediately post it. I get a post on my Facebook page, and you can't imagine how many likes, and especially if it's really compelling, how many shares you'll get on your Facebook page. And it really disseminates you as a community, an element in the community, and hopefully you're doing something good. So I don't know if there's a community cause that near and dear to your heart. I really think it's a good idea to try to include it into your practice, find the charity that's right for you, and try to do that. So here's some more examples of some cases. This is an intriguing case. I think it came all the way from Seattle, George. George was undergoing very strong radiotherapy treatments for cancer. And I got a call from the woman who booked a hotel room, a luxury hotel room in Soho, and I would go there a couple of times a week and detox this dog after his radiotherapy treatments. And the owner gave me pretty good feedback on how the dog did with the treatments. It was obviously the radiotherapy takes its toll, but I don't know if, I'm sure some of the other acupuncturists in the room have had hospice and post-operative care and post-surgical care and post-radiotherapy care. So it may be useful in that. Katie, K-A-D-Y, feline asthma. I know in the human world asthma is a problem in children. Well, it's a big problem in the cat world. And we were happy to report that through the use of specific acupuncture points, lung 7, heart 7, bladder 13, for the acupuncturists out there in our terminology, those are all good points that helped Katie reduce the amount of medicines the owner was giving. And I got stories of this cat is really running around having a great time. So useful in cases of asthma in animals. This is an example of chew softly and carry a big stick. Thilo. Thilo is owned by two jazz enthusiasts. How should I put it? The love child of a Italian greyhound and a chihuahua that I don't know where they met. Thilo was diagnosed with a mysterious front end lameness. In the dog world, any acupuncturist can fix the hips, sort of lower back, that's easy. But the front end is really hard, it's very tricky. And I'm trained in rehab, and even going back to school and studying rehab, there's so many new types of disease, brachiocephalic syndromes, all these types of things. It's also very hard to diagnose for the veterinarian. It's hard to take a good x-ray, there's so much muscle up there. It's hard to get the animal to relax so you could elicit a certain type of click in the elbow. So often I get referrals from referral institutes for front end problems, whatever that means. And again, it ends up with the acupuncturist. Front end lameness is something we see often as veterinary acupuncturists. Well, it's all in the family here, and this is the nice thing, and I know any of you practitioners here that do house calls, hopefully you have some cheerful experiences. Being a holistic practitioner, there's only certain things you can glean when you're in the house. For instance, excess and deficiency. Does the dog like to lie on cold, hard surfaces? Does it want the cushy pillow? Does the cat like to bake itself in the sun? What time does it bake itself in the sun? These are all sort of acupuncturist, holistic questions. I get to learn a lot about the relationships between the people and their pets, between the various pets in the household, the dynamics of the household, and hopefully it gives me a little bit more insight to the holistic and the entirety of the situation in which the pet lives, and perhaps gives me some clues as to how to best treat things. Okay, a senior named Junior. He's only 18, owned by my client Chingy. We go there twice a week. My associate goes there on Fridays. I come by on Tuesdays. Just again, an example of the efforts people make to save these creatures. It's really heartwarming. The story is this cat was found with 2 broken legs as a kitten. It was, I think, found in Arizona by her sisters. She transported back to New York, brought it to vets, had the legs pinned, and cat's doing great. And then at the age of 16 had a stroke. But, you know, as I say, how many lives did I have? We're at life number 4 still here. So I see Junior twice a week for the acupuncture, and he's doing quite well. But nowadays, cats live to extraordinarily long. When I was a kennel kid back when, you know, 12-year-old cat was old. But I guess we've made enough advances in their care, and with other things, general medicine specialists, and a little acupuncture thrown in to make their lives a little bit more enduring. This is doggy elder care, and it was a Great Dane who just wasn't herself anymore, doldrums, you know, a midlife crisis. The owners referred to me through a neighbor. Well, I spoke to the owner about what's called I call them geriatric tune-ups. And we've been doing geriatric tune-ups on this Great Dane, and again, how do you know it works? They can't talk. I guess the placebo effect is not as pronounced, because I know very few dogs or cats that'll get up and act for their owners to make them happy for spending $135 for a follow-up acupuncture treatment. So, you know, they keep calling back to people, so I guess it must work. And I've had the surgeons call me. You know, I'm trained as a scientist, to be honest. You know, I have a BA in science. I worked in labs. I'm schooled as a scientist. But I remember one of the surgeons at the Animal Medical Center said, "Jeff, trust me, it works." So it's nice to hear that type of affirmation coming from your professional specialist. I love endorphins. I love endorphins. This is the shape. Anybody ever hang out with a Dalmatian or a Wheaton? It's like, you know, the straw man from the Wizard of Oz. Well, this was into the 3rd treatment. Slept like a baby. And I'm convinced there's an endorphin release. And I tell people, when that head drops and they lay down, they do a little stretch. Usually the 2nd to 3rd meeting. And the other thing that I'd like to point out, I call it the intangibles. The intangibles. I hear all these funny things back from people. And one of my maxims is they say, Doc, what should I expect? What will my dog do? I said, I'm not going to talk. You'll tell me. I don't want to paint your expectations. I don't want you to parrot back anything. I don't know. We'll talk, and I can tell from your conversations if it's working or not. And I remember the case of George, the chocolate lab. He was a huge chocolate lab. He was ancient. And I remember Ellen. I went to Ellen's. She opened the door, and she's beaming. I said, Ellen, what happened with George? She says, well, Doc, he pooped today, and after he pooped, he scratched his back legs. He hasn't done that in months. It's the little things, these intangibles, pulling out the toy, the squeaker toy the dog hasn't played with, the cat that bounces up and goes on the mantelpiece that hasn't done it in 6 months. Dylan, another one. Dylan was actually missing an eye because he had an enucleation. Liver disease, this is another dog, and I was so surprised myself. I asked Sarah, how's Dylan doing? And little did I know that Sarah, without telling me, had taken Dylan off all his medications, even the painkiller, which I didn't know, and he did just fine. This is Novia, that's Spanish for girlfriend. She was the mayor of the neighborhood. So it was important to get her out again and walking again, and with Stephanie, her owner. This is a great little story. Randolph. Randolph was a Frenchie. When I first met him, he was diagnosed with a horrible intervertebral malformation in his back. He was a skinny little marink there, and I couldn't imagine how he was going to survive. So we did acupuncture. 2 years later, I got postcards from him. He went on a theatrical tour with his actress, Mommy. They went on a tour of cabaret all through the country with Randolph. It's really amazing. And then what about the sense of humor? People have a lot of sense of humor with their pets. This is Bob, but unfortunately, he became corn on the bob in the summer. Poor guy became bobsled at Christmas. The life of a cat, you know, to be dressed up and tortured like that. Back to Asti. This is Asti relaxing in the house. His favorite pastime is drinking from the sink. Asti was recently hospitalized with severe pneumonia, almost lost him. But I'm happy to report, I put him over. You know, it's tough to treat your own pet. I brought him to a specialty clinic. He lived in an oxygen cage for 5 days. It would have been cheaper to rent a room in the Four Seasons Hotel for all of us. But he's back home, and he's waking me up at 6 in the morning for breakfast. Real quick, this is one of the things I do for community activities. I got a band. And if you want to hear our music, PET, P-E-T, Rocks, R-O-X, music, P-E-T, R-O-X, music, petrocksmusic.com. We played maybe 100 events all through the city. We cut an album. If you go to the Pet Rocks music page, you can hear samples off our platinum, soon-to-be platinum album, maybe one day platinum album, called Just Sniffing Around. Our band is made up entirely of animal welfare people. The two singers you see there backing me up are the Roxettes from Pet Rocks, and they're dog walkers. Okay, this is the change in my life. Her name is Valentina Ruby Levy. She really likes animals. I'm so happy. Here I am indoctrinating her to the world of animals, and we're having a good time. And based on this addition to my life, I'm turning the music, hopefully, into a family-friendly musical extravaganza that maybe we'll see on Broadway, if not off Broadway, if not in my garage one day. So back to the story. So acupuncture. How do you know it works? They can't talk. So I forgot about it, okay? 6 weeks later, some Sunday night, about 6 o'clock, the phone is ringing off the hook. Jeff, you're on television. Jeff, huh? None other than the legendary Andy Rooney, who I stumped, I guess, with my pediatrician answer. So as it ended, how do you know it works, they can't talk? Well, that was Mr. Rooney's question. Alrighty, a big woof woof to everybody, and it was, thanks for your time.